Hi friends, welcome to this video on diarrhea. Diarrhea causes dehydration and it is very important to treat dehydration. So let's begin. Diarrhea is abnormal frequent passage of loose stools or abnormal passage of stools with increased frequency, fluidity and weight and with increased stool water excretion. Acute diarrhea, sudden onset in a previously healthy person with 3 days to 2 weeks of duration, self-limiting and resolves without any sequelae. Chronic diarrhea lasts for more than 3 weeks, associated with recurrent passage of diarrheal stools, fever, loss of appetite, nausea, vomiting, and weight loss, and chronic weakness. Acute diarrhea causes include bacterial, viral, drug-induced, nutritional protozoal, chronic diarrhea, tumors, diabetes, adhesions, and hyperthyroidism, irritable bowel syndrome, and Crohn's disease. Common causes of diarrhea include viruses, rota, adeno, astro, calcivirus, and Norvac agents. Bacterial causes Vibrio shigella, E. coli, Salmonella, Campylobacter, Staphylococcal, and Vibrio parahemolyticus and Clostridium difficile. Common causes of diarrhea others include metabolic hyperthyroidism, diabetes, pancreatic insufficiency, lactose intolerance, and antibiotics like amoxicillin and magnesium supplements or antacids containing magnesium. Common causes of diarrhea parasites include Enterobius histolytica, Giardia, and Cryptosporidium and Isospora. Drugs causing diarrhea, these are all the drugs. Transmission is fecal-oral. Cholera is waterborne disease transmitted through water contaminated with feces. Some viruses like rotavirus can be transmitted through air and nosocomial transmission also possible. Shigellosis, blood dysentery is mainly transmitted from person to person. So cholera is more common and rotavirus in winter and shigellosis dry summer. So what are the symptoms of the cholera? Rice watery stools, marked dehydration, but no fever with projectile vomiting. Patient may become shocked or unconscious. Symptoms of E. coli, yellow watery stools with vomiting and dehydration, moderate to severe fever, often of moderate rate and mild abdominal pain. Rotavirus diarrhea symptoms include prodromal symptoms, fever, cough, vomiting preceding diarrhea, and stools are watery or semi-liquid. The color is greenish or yellowish, typically looks like yogurt mixed in water. Mild to moderate dehydration will be there, and symptoms of shigellosis, frequent passage of scanty amount of stools, mostly mixed with blood and some mucus, and moderate to high-grade fever and severe abdominal cramps and tenesmus, pain around the anus during defecation, and usually no dehydration. Amoebiasis of offensive bulky stools containing mostly mucus and sometimes blood, and lower abdominal cramps and mild grade fever and no dehydration. Stools in case of giardiasis is greenish hue and may contain some blood. In case of amoebiasis, mucus and blood are often seen. Gastrointestinal symptoms in case of giardiasis, diarrhea, painful cramps, flatulence, and nausea. In case of amoebiasis, diarrhea alternates with constipation, flatulence, and painful cramps. Assessment of dehydration, mild, moderate, and severe. In case of mild dehydration, appearance will be irritable and thirst. Anterior fontanelle will be normal. Eyes are normal. Whereas moderate, there will be depressed anterior fontanelle. Eyes are sunken. In case of severe dehydration, there will be lethargy, coma, unconscious, and markedly depressed anterior fontanelle, sunken eyeballs. Pulse is normal in mild, a rapid and low volume pulse in moderate, and severe dehydration, there will be feeble or imperceptible pulse. Urine normal, dark and scanty, weight loss less than 5, 6 to 9, and more than 10% of weight loss in severe dehydration. Complications of watery diarrhea mainly is electrolyte imbalances, tetany, convulsions, hypoglycemia, renal failure, hemolytic uremic syndromes, and toxic microcolon, protein losing enteropathy, finally perforation. Acute diarrhea, if it is history and physical examination suggestive of non-infectious, evaluate and treat. If there is an infection, mild, moderate, and severe dehydration is there, first conduct the fluid balance. Then observe if it is results okay. If it is persist, go for stool microbiological studies. If also fever, if fever is more than 38 or bloody stools increased or fecal WBC, we can go with microbial studies, and based on that we can give empirical or specific treatment. So routine microscopy of to look cross color consistency, mucus parasites, microscopy of Edmond saline and iodine and to look for pus cells, to look for ova sister trophozoite, to look for any darting motility in case of Vibrio and colony characteristics, Staphylococcus, E. coli, Salmonella, Vibrio. Each will have different colony characteristics. And gram staining, the appearance will be different for each organisms and motility also non-motility staph aureus and Shigella, motility Salmonella, E. coli and Vibrio. Equally is gram-negative bacillus, salmonella gram-negative, vibrio gram-negative, gamma shape. Staph is gram-positive cocci in clusters. And equally will be indole positive and MR positive and salmonella also MR positive. Some tests are there for staphylococcus catalase positive, coagulase positive. This is a trophozoite in case of stool sample showing Entamoeba histolytica and RBCs. This is stool sample fecal WBC smear and few RBCs and WBCs are there. Treatment of dehydration mainly increase the fluid intake and ORS. ORS glucose concentration between 80 to 120 are needed to optimize sodium absorption in the small intestine. Sodium concentration is 75 millimole per liter. Higher concentration may cause hypernatremia. Dose in mild or moderate diarrhea is 2 liter first 24 hours followed by 200 ml per each loose stool. So standard ORS at low osmolarity. Now we are using low osmolarity ORS. Why reduced osmolarity ORS? There is 39% reduction in need for intravenous fluid and 19% reduction in the stool output and less risk of hyponatremia. So sodium chloride 2.6 grams, concentration in millimoles, sodium 75, potassium 20, chloride 65, and citrate 10, and dextrose 75. Homemade ORS, 40 grams of sugar can be used with 5 grams of common salt and to be dissolved in 1 liter of clean water. Zinc has role in diarrhea. Zinc will reduce the stool volume, reduce the duration of the diarrhea. Elemental zinc 20 milligram per day for 6 months and older for 14 days and 10 milligram per day between 2 to 6 months. Any of zinc salts can be used and anti-diarrheal agents like loperamide and resicatrotryl. Patients with mild to moderate acute diarrhea. Contraindications of these anti-motility and agents are patients with bloody diarrhea, any fever or systemic toxicity, discontinuation in patients whose diarrhea is worsening despite therapy. Antimicrobials who have this positive stool culture presented with dysentery and suspected exposure to bacterial infection. Antibiotics in acute dysentery. Cotrimoxazole has been recommended as the first line for acute bloody diarrhea. High resistance of Shigella to clotrimazole is reported. Resistance rates to cotrimoxazole exceed 30%. Cefixime next line is cefixime 20 milligram per kg per day. 5 to 7 days should be used instead of quinolones. If no response to cefixime in 3 days, we can use ceftriaxone 50 to 100 milligram per kg OD for 2 to 5 days. Antibiotic in acute dysentery, metronidazole or tinazole should be used when cases of acute dysentery fail to respond to second-line drugs for dysentery such as cefixime or when stool examination has confirmed trophozoite of Entamoeba histolytica. Diet. Initially oral fluids for 24 hours, plenty of water, buttermilk, coconut water, fruit juice. Once frequency has decreased, we can give overripe banana, curd, soft rice, dal, and we can avoid milk products because they cause secondary lactate deficiency. Loperamide 2 capsules stand and 1 capsule after each loose stool till loose stools is stopped. Don't exceed 8 capsules per day. Don't give in children below 4 years. To restore a bacterial flora, we can give lactobacillus. Resicatrotryl is 100 mg TDS to increase the reabsorption of water. If associated with abdominal pain, give cyclopam TDS. Don't use metoclopramide and loperamide together. Metoclopramide 2 ml IM can be given if vomiting is there. Watch for extrapyramidal symptoms. If fever is there, if it is infective origin, so use the antibiotic. Give Cipro 500 VD or Norflux 400 VD and metronidazole 400 TDS or tinidazole 500 VD and stop iron ampicillin drugs. If BP fallen or severe dehydration, IV fluids, RLR NS 2 to 13 bottles depending on the dehydration. Injection Decadra and Dexa 2 cc IV start. Mefentin 2 cc IV if BB is below 80 millimeters of mercury. Gentamicin 80 mg can be given if we suspect sepsis. And amoebic dysentery is common with mucus diarrhea. If it is there, we can give 1 500 mg BD or 10 500 mg BD for 5 days. Lysine gel to reduce after a metallic taste and nausea due to anti-amoebic agents, and avoid oily foods, ghee, milk, and chilies. If infective, in case of chronic diarrhea, give metronidazole 400 TDS and mebendazole BD for 3 days, 100 mg BD. And sulfaguanidine, intestinal antibiotic, 1 tablet TDS 10 days can be given. But don't keep on treating chronic diarrhea. Appropriate referral should be there in case of chronic diarrhea. Remember, if stools are black colored with pallor and low BP, suspect duodenal ulcer which is bleeding. Gastrocolic reflux, running to bathroom after food intake. Treat as mucus diarrhea. If it is not responding, then it is physiological. If any elderly person with diarrhea on and off, with or without blood, refer for colonoscopy to rule out CA, cancer, colon. And amoebic dysentery is common in India. Give flagyl or tinidazole in all cases of dysentery, flatulence, indigestion, and intestinal colic. Do not go on treating chronic diarrhea empirically. It might be TB if it is associated with fever, weight loss, or anorexia. Proper referral should be there. Thank you.